No, I'm not sure what I'm going to be eating for lunch. Yeah, no, but I'm really fine with anything, so you can pick. Okay, yeah. Alright, I'll talk to you in a bit. Yeah, I'm a little bit busy right now. Okay, yeah, bye. Sorry about that. We were finishing up a conversation and you're here a little bit early, but no worries. Welcome in. Nice to meet you. My name is Kate. I'll be cleaning your teeth today before the dentist takes a final look at you, okay? Alright, great. So, before we begin, I'm just going to start by telling you what exactly I will be doing. So, this is a diagram of your teeth. Not your teeth, but teeth. So, what I'm going to be doing is I'm just going to be cleaning along your gums, scraping off any plaque, built up residue, anything along those lines. I'm just going to be scraping that off for you, and then I am going to brush your teeth for you, obviously, and if we have any other issues, we'll go from there, okay? Yeah, but I am not anticipating there being really a problem, so, alright, so, let's continue. First, let me get a glove on. So, this hand, I promise you, is disinfected, and I will be primarily using it just to kind of move around your mouth. This is the only hand that will be going inside your mouth, okay? As long as you're fine with me not having the other glove on, I do prefer to work this way, but if you need the other glove, by all means, let me know. You're good? Okay, great, then I'm good too. Alright, so, before we begin, I'm just going to do a little bit of an inspection of your teeth. So, can you say, Okay. Just taking a look. I'm just going to have you open up your mouth just a little bit more, okay? Alright. I'm just going to take a look. Just going to see if you have any issues back here. Going to check right here as well. Right here. Are you saying, thank you. Okay. Have you been experiencing any irritation? Please do let me know. Do not hesitate. Nothing is embarrassing, I promise. Nothing is embarrassing. Do you brush your teeth every morning and night? Okay. Do you floss regularly? What type of floss do you use? Okay. Alright. Okay, so thank you for answering my questions, even though your mouth was open. I know it's a little bit difficult, but I kind of understand with the gestures. When I got my teeth cleaned the other day, I was asked, what type of floss do you use? And I went, "Rrrr," and she knew exactly what I meant. Bless her soul. So I understand the exact same. Do not worry, do not fret. Okay, so now I'm just going to tap each of your teeth, and you're going to tell me if that causes you any pain, okay? Yeah, just give me a moment. Okay. Okay, now ready. Okay, what about this one? This one? Okay. Alright. So, all seems to be well there. I'm just going to move my seat a little closer. Are you sure none of this hurts at all? Because I see you wincing a little bit on this molar right here. It hurts a little. Okay. So I'm just going to put on my glove once more. And I'm just going to tap it with this Q-tip, okay? And please do let me know if this hurts. It does. Okay, so if I tap with the Q-tip and it does still hurt, let me take a look at it again. Okay, yeah. So since it does hurt, I do see some discoloration on the tooth there. Possibly some decay going on. We may have to remove that tooth. Have you ever had a tooth removal before? Okay, well, it's not too bad. It really shouldn't be painful at all. So, as long as we get through today's cleaning, I should be able to very quickly remove it at the end for you. Were you aware of that tooth causing you issues prior to the appointment? You were? Okay. Well, let's just continue on with our cleaning, okay? Right, I'm just going to avoid that tooth for now, though. Can you open a little bit wider for me? Thank you. Did you brush before coming? Yeah, I can tell. Your teeth are already very clean. Yeah, some dentist's offices are a bit different. I know I don't come here as a patient, but my cleaning only takes like 20 minutes max. But I have worked at other places that prefer us to do these more tedious steps, because we believe that it does make it worth it. I don't really need that long of a cleaning just because I do maintain my oral hygiene very well. But that is also because I have studied it, so it's a bit easier for me. We do not anticipate the everyday person keeping up with it as well, although you should. We don't expect it as much. Okay. So I am seeing some bleeding. So I'm just going to put this here. It's just going to suck up some of that blood and the additional saliva that has accumulated. Okay. I'm just going to continue on with the cleaning. Yeah, I could keep that in your mouth if your saliva just continues to grow, but right now you seem to be fine. And sometimes it can get a little bit uncomfortable. Okay. Just going to readjust myself just a bit. Come in right here. Okay. Sorry, I'm a bit close. I apologize. Okay. Okay. So, now that I have done that portion of the cleaning, I'm just going... Can you just bite down on this for a moment for me? Thank you. I'm just going to grab the toothbrush and toothpaste. You'll be getting toothpaste for yourself after, but you can keep this toothbrush. Alright, you can release this. Thank you. I'm just going to brush your teeth for you, okay? So because I do see some bleeding, I'm going to teach you a new method to brushing your teeth, okay? So when you brush your teeth, do you have a tendency to just like scrub like this horizontally? Okay, yeah, I can tell you have a little bit too much bleeding than we want to see. Instead of doing that, because your gum has inflamed a bit, it is a bit puffy, and that's due to the irritation of your brushing. Although your teeth are very clean, it has been irritating your gums, so it's been causing some bleeding, okay? So the best way to avoid this would be, I'm going to use this diagram here, and just brush in a circular motion right below the gum line. That way you're not irritating your gums, okay? Because when we brush like this, sometimes it can just cause irritation here when we should be cleaning the teeth and not the gums. We don't need to be scrubbing our gums, right? So just try and scrub the tooth as best as you can, and also keeping up with flossing regularly also prevents bleeding from the gums, right? So if you say you're flossing as regularly as you can, or you have been flossing regularly, then the bleeding could be due to your scrubbing too hard, okay? Is that what you've been doing? Yeah. Okay. Do you use an electric toothbrush at home, or do you use these regular toothbrushes? Okay, yeah. But I'll be giving you this one today, so just make sure to... Right? Alright. It's also good to change out your toothbrush. Don't want the bristles to be getting too soft. Okay. And as a result today, I'm just going to be brushing like this for you, alright? Can you open just a little wider? Thank you. Okay. Just going to come right here. Alright. Okay. Alright. Coming over this side. Sorry, I know the angles are a bit crazy, but that's kind of what it's like being at the dentist. Got my teeth cleaned a few days ago. I personally hate being in your position, so I don't blame you at all if you're just a tad uncomfortable. If you were super comfortable, I would be just a bit confused. I mean, some people really like getting their teeth cleaned. Okay, let me just scrub. Okay, can you just open a bit wider for me? Thank okay? So say once again. Alright, yeah, I'm trying to avoid the one in the back because it's not like we really need to clean it. I will be removing it. So the reason why, I figured I should explain this, the reason why we remove it after is because if your mouth is like unclean before we pull out the tooth, it can cause more damage than there needs to be. That makes sense. It's like you wouldn't, like say you happen to step on a nail, right? Heaven forbid you step on a nail. You wouldn't just pull it out, you try and get disinfectant and all of that already ready, and you know there's protocols and steps you take, and this is just some of the steps you take, you know. Okay. Alright, great. So now that you're all scrubbed, can you just turn quickly to the side for me and spit in the cup to your left? Thank you, and I'm just going to fill that up again for you. Now, can you gargle and rinse? Fantastic. Okay, great. So now, I'm going to remove that pesky tooth, okay? So, just going to give you a quick injection, okay? This part is the only part you will feel, okay? As long as all goes well. Ready? 3, 2, 1. Okay. Alright. Let's just let it sit for a moment. Let it sit, let it sit, let it sit for a moment. Okay. And now, tell me if you can feel this on your gums. Slightly. Okay, but like, can you really like feel it? Because this is super sharp. It just, you can feel pressure. Good. That's what we need. Too much can be more harmful than beneficial. So, just going to carve this out. Okay, great. Right, let me just take a look again back there. Okay. Alright. So now, I'm just going to wiggle it out, okay? Can you just open your mouth as wide as you can? Wiggle, 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 wiggle. 3, 2, 1. And fantastic. Seems like I have got it. So, just going to put this gauze right here in your mouth. Okay, now can you bite down for me? Good. Great. So, the procedure has been done. So, you're going to need to come back to get that checked, make sure all is well, but you didn't experience any pain, right? Fantastic. Yeah, just some pressure. It's the pressure when the tooth leaves your mouth, but you should be good. When the pain reliever kind of dissipates, you will start to feel an ache, right? And you might even have some minor swelling, but that should go away in maybe 2 days, if you're lucky. So do not fret, it's not super long. I will be having the dentist come in and make sure that everything was done correctly, but you should be good. So usually, yes, the dentist does do the teeth removals, but I am someone that just cleans the teeth, but I am also a dentist as well. I just am not your dentist, so, but it's fine. It doesn't really matter. It really just comes down to, like, insurance and whatever, so it doesn't matter. So, it could have been me, it could have been her, doesn't really matter. Yeah, no, I know. It gets kind of confusing. It's not really important on your end, it's mainly important on our ends, but we have a tendency to do this. She took out one of my clients' teeth the other day. It's a shared practice. It's not just mine. It's not just hers. So, yeah, I hope that wasn't too strange. So, just adjust this light really quick. And can you just say, ah? Okay, wait, I'm gonna hold that down. Say, ah. Okay, yeah, great. Fantastic. Alright, now bite down again. Great. So, when you leave, the pain reliever did not impact anything other than just relief there, so you're good to drive, you're good to go. I will be packing up this for you, okay? So remember to take it with you, and I know I said that 20 minutes was short for a tooth cleaning session, but that actually I think is how long this was. Usually they wind up being a little longer, but you clean your teeth really well, like surprisingly so. I'm a little bit of suspicious, other than the fact, of course, you had some bleeding, which is not good. Okay, so I will be heading out now. It is about time for my lunch, and I hope you have a fantastic rest of your day. Okay, bye. Thank you so much for stopping